Now, you might want to think twice about getting a hysterectomy. Of course, check with your doctor before taking on that recommendation, which that sounds kind of weird, but I had to give that disclaimer. But I want to talk about the serious consequences and side effects from hysterectomies. First thing you need to know is that 90% of all hysterectomies are not life-threatening, okay? Because one of the reasons they do them is cancer, but that's less than 8%, okay? The great majority of hysterectomies are basically unnecessary, and you should really know what you're getting yourself into. It's the second most common female surgery behind C-sections. And if someone tells you, well, you're approaching menopause and you really don't need your ovaries because they stop working, don't buy that. The ovaries continue to work beyond menopause, okay? They produce significant amounts of androgens, which then can be turned into estrogen. And if your doctor disagrees with you, just ask them, then why do I need hormone replacement therapy after I have a full hysterectomy? Well, it's actually because you don't have the ovaries to produce those female hormones anymore. Okay, consequences, the side effects of hysterectomy. Well, the big one is going to change your figure in a very negative way, because when you cut this band of ligaments that are attached to the uterus, those ligaments are also attached to the spine, the hips, part of your pelvis, and basically you're collapsing the internal part of your torso, the core of the inside of your midsection. That causes the hips to widen. That causes the rib cage to shift downward. It can also give you a shortened, thick midsection appearance and a protruded belly. And many times when you hopefully see an informed consent, you don't really see this side effect. Number two, lower back pain. Why? Because you just created a lot of instability in your pelvis, not to mention the potential for a leaky bladder and a loss of libido, which is number four. Number five, emotional roller coaster. It can really affect your emotions because if there's any fluctuations of estrogen or progesterone downward or upward, that can affect your emotional state of mind. Number six, fatigue. Number seven, it can increase your risk of getting fractures because now you're in a state where you could potentially get either osteopenia or osteoporosis because of the loss of estrogen. Number eight, it can increase your risk of all-cause mortality, including coronary heart disease. Now, sometimes they'll say, well, you know, you're going to take your ovaries out. That way it can decrease your risk of potentially getting ovarian cancer down the road. So you're going to take out an organ to prevent cancer from developing in that organ, which, by the way, ovarian cancer is rare, especially if you're going to compare the death from ovarian cancer to the increased risk of dying from a hysterectomy. This is a much greater risk than getting ovarian cancer and dying from ovarian cancer. Number nine, an average female who has a hysterectomy gains 25 pounds within the first year. Now, instead of getting hysterectomy, why don't we then identify the reason for the hysterectomy, okay? Let's take a look at that. All right, we have fibroids, okay? We have endometriosis. Already talked about cancer, excessive bleeding or heavy cycles, okay? What could you do to resolve these? That would be a new concept. Well, number one, black cohosh is pretty effective for uterine fibroids. Number two, I would highly recommend you avoid soy, especially the soy protein isolates in so many different foods. And it can affect estrogen-sensitive tissue, like the uterus, like the ovary, the cervix, and other tissues, even the thyroid. You don't want to be either taking extra estrogen or consuming foods that are estrogenic. This is why I also recommend, if you have fibroids or endometriosis, to avoid dairy, because dairy is originally designed to help grow a calf. So there's a lot of growth hormones in there. So anything that increases growth, you want to avoid. And there's several hormones that will do that. Estrogen will do it, and insulin will do it as well. So that's why going on a low-carb diet would be smart. Insulin is anabolic. It makes things get bigger, but so is estrogen. So you want to avoid soy, dairy, and carbs, especially the refined carbohydrates. Of course, you can have vegetables, as in the cruciferous vegetables. Cruciferous vegetables they help balance the estrogen. They're not going to increase more estrogen. They're going to shift from the bad estrogen to the good estrogen, but they also detoxify the liver of things that can mimic estrogen, as in endocrine disruptors. So there are certain things in the environment, pesticides, insecticides, herbicides, fungicides, heavy metals, plastics. This is an herbicide, glyphosate. It's in all the different GMO foods, right? These chemicals in the environment are endocrine disruptors, but they also mimic estrogen, okay? So what we want to do is we want to go organic. We want to really limit the exposure to chemicals, and at the same time consume cruciferous vegetables that can help detoxify these chemicals from your body. Also, there's an interesting correlation between vitamin D deficiency in fibroids and endometriosis. So I would just recommend getting enough vitamin D if you have fibroids, endometriosis, or even heavy periods, because think about it, the uterus is a muscle, right? So it needs calcium, it needs magnesium. When you take vitamin D, what do? You increase the absorption of calcium and other minerals. And what's better for a cramp than having more of these minerals? The other thing I wanted to mention related to glyphosate, it blocks vitamin A. And there's some research, I'll put it down below, that shows a connection between low vitamin A and developing fibroids, okay? And I'm not saying you should start taking vitamin A. Of course, you should eat the foods high in vitamin A, like butter, cod liver oil, egg yolks. That would be beneficial. But I'm just pointing that out in case that might be your situation. Now, one last point. Let's say you already had a hysterectomy, okay? Is there anything else you can do in addition to what I talked about right here? Yes, there is a really wonderful product from Standard Process. I'm not affiliated with them anymore, but Standard Process has a product called Utrophin PMG, okay? Utrophin PMG. I would take that. I would recommend taking maybe two of those before you go to bed. The second thing I would take if you had your ovaries removed is another product from Standard Process called Ovatrophin PMG. Okay, so Ovatrophin PMG, take one of those before bed. And it's likely that you'll see an improvement in your symptoms. And that goes beyond what I recommended right here. Now, since we're on the topic of female hormones, there's a really good video on estrogen that I would highly recommend. And I put it up right here. Check it out.